tracking developments in the trial of 3 Tacoma police officers in the death of Manuel Ellis. Thanks for joining us. I'm Christine Pay. Ellis died while being restrained by police in March of 2020. Officers Matthew Collins, Christopher Burbank, and Timothy Rankin are all facing charges in his death. King 5 is live streaming the entire trial from opening to closing statements. We take you now to the courtroom live.
That during Lieutenant Wilson's direct testimony, he was shown, and the jury was shown Exhibit 173. And I believe 173 was one of the exhibits that was objected to and we kept out on the basis of being cumulative. Because it's cumulative, I'm not sure it's too big a deal, but it does highlight the problem of being particularly careful about showing exhibits to the jury that have not actually been admitted. It was an honest error, I think, an innocent error, and obviously now I don't know whether or not the defendants are going to have to reference it or not in their cross-examination. They certainly can do so if they care to. But
thank you. My apologies. My notes obviously were imperfect in terms of the numbers that had been admitted.
yeah. Okay. Any other comment from any of the defense? No, Your Honor. Okay. So at the moment, I could admit 173 if you want me to. I could just leave it because I don't see any reason not to, except that it was cumulative. And since they've seen it, or we could continue to leave it out and you can reference it during your cross-examination if you care to, but otherwise leave it out when it goes back to the jury later. How does defense prefer to proceed in that regard?
Just leave it out. I would agree, just leave it out. I don't think it's a big deal for it anyway. But,
It's not particularly.
I would just, it is what it is. I don't intend to reference it, and I don't think we should do it.
Okay. Okay. All right. So we're resuming with cross-examination by Mr. Osser, right?
Or
Ossier? Is that the French? Is that the French? Is that the French pronunciation?
I heard that yesterday and I thought, oh, we've been saying it.
We've been saying it wrong all this time.
Sorry. Well,
What's wrong?
as Mr. Johnson
What?
refers to you as Steve Johnson.
Oh, yeah, your worshipful master, yeah.
Okay, I'm gonna go get the jury.
As you might imagine, Mr. Osser, my name's been mispronounced a few times in the past. It saved me one time as a school kid. I was talking in class, I was in 3rd grade. So you have to remember how long ago that was, a long time ago. And so my 3rd grade teacher thundered my name out, but instead of getting Chushkov out, she got Khrushchev, who at the time, of course, was the head of Russia. And then she realized what she'd done and started laughing and couldn't get mad at me anymore. So it saved me once.
bring out your shoe.
Brought my shoe out. We will bury you. Nice reference. Good job, Mr. Fricking. I think I had a case with Mr. Pertzer years ago, and the name Adolf Eichmann came up, and they all looked at me like I was from Mars. Who's Adolf Eichmann? Unbelievable. Welcome back. And for Juror 5, please remove your hat. And just, we saw it with his hood up when he came in. Anyway. So, Mr. Osler, continue when you're ready.
Thank you. Good afternoon, Lieutenant.
Good
Do
afternoon.
you still have Exhibit 24 in front of you?
I do.
You went through with this, the body, I'll call it the narrative of 24, meaning what we were told in the first paragraph, your findings in the subsequent paragraph, is that right?
That's correct.
And your ultimate opinion in this case was that there was cardiac arrest secondary to excited delirium, right?
Correct. That's my professional medical opinion.
Okay. And that was, that has been your opinion since you authored that report, right?
That's correct.
That was your opinion at your first interview with the Washington State Patrol back in September of 2020, right?
That's correct.
And that was also still your opinion in March of 2021 when you met with Ms. Eakes, Mr. Liu, Investigator Heitzman, and Dr. Clark, right?
That's correct.
And it was during your discussion about that opinion that Dr. Clark then suggested or asked about brain death.
Correct.
Okay. And you were clear then, and you've been clear now, that your opinion is that the most likely diagnosis from your totality of treatment of Mr. Ellis was cardiac arrest secondary to excited delirium, right?
Correct.
Okay. What is excited delirium?
Excited delirium is an acute agitated state, oftentimes induced by drugs. Patients are incoherent or violent or physically unable to be helped. They become agitated. If some sort of physical exertion is experienced, they can potentially deteriorate rather quickly.
And so would you agree, Lieutenant, that generally there's a constellation of symptomology consistent where you have a finding of excited delirium?
In my career or in general?
Well, both in your career and in your training.
Correct. It's something that is in our text, it's in our training, it's in our protocol in the county, spelled out exactly as that, and we treat it very aggressively because this is a very serious condition.
Right, this is a condition that oftentimes results in what is termed sudden death, right?
Correct. It can happen very abruptly, very quickly, and without warning.
And usually without any sort of anatomy as to what's causing the death, just the person expires, right?
Correct.
Consistent with what you found here.
According to the subjective information I received and then my objective findings, correct.
And I think on direct examination to Ms. Eakes, you expressed that you've been doing this about 20 years.
Correct.
And how often would you estimate you've encountered the symptomology of excited delirium that we just discussed? Somebody else.
Someone's got a phone ringing.
There's a definite correlation.
Sorry, can you repeat the question?
Okay.
Sorry about that.
I said in the 20 years that you've described your experience, how often have you experienced individuals that you believe suffer from excited delirium?
It depends on the municipality that I was with, right? So larger populations, increased density, better access to illicit substances increases that. So here in Tacoma, we see individuals in these agitated, excited states quite often for unknown reasons. Psychosis, drug-induced psychosis, combination of the two. It's a common thing, but this presentation is also common, but the subsequent outcome going into cardiac arrest is not, it's not something we see every day. It's something we try to treat before they deteriorate to this point. If we're on scene and the scene is safe, perhaps we can help sedate, put the patient in a tranquil state, and manage all of these things prior to cardiac arrest.
And it's important to act expeditiously if you have information that the individual might be exhibiting symptoms of excited delirium, right?
Absolutely.
And in this case, whoever you talked to initially, whether it was Officer Collins or not, they provided you information that there was a belief based on their interaction that Mr. Ellis was suffering from excited delirium.
They did.
And that is important to you because that's going to trigger the urgency with which you're going to treat and what you're looking for, right?
That's correct, because our initial dispatch is that we're going to evaluate an individual in custody. We arrive on scene, and now we have an individual that is suffering from excited delirium. That's an incredibly higher level of care that this individual is going to require. So we move with an economy of motion to the patient and render care as effectively as we humanly can possible.
And that's because your training experience tells you that they can die very quickly if, in fact, they're suffering from excited delirium.
Absolutely.
Which is what happened.
That is what happened here.
And you expressed that both in your interview with the State Patrol in September of 2020, right?
Expressed.
Your opinion that cardiac arrest secondary to excited delirium was
I have.
your findings, right? And again to the Attorney General's office in March of 2021, right?
Correct.
You're not getting paid for that opinion, right?
No, sir.
That's just your training experience in relaying what you found on March 3rd, 2020, right?
Correct. This is my job. This is what I go to work to do. This is what I think about when I'm not at work. I train, we study, we practice, we review, we critique, and we try to be as effective as we can. And in Tacoma, I think we're very good at what we do. And despite our best efforts, this was the outcome.
Right. Stand by your opinion today, too.
I do. 3.5 years later.
Thank you. That's all.
Yep. Good afternoon.
Okay, so the first thing I want to talk to you about is your background and training. Obviously, you testified that you're a paramedic.
That's correct.
You said that you go to 6 months of training for that, is that right?
Yeah, it depends on the paramedic program you go through. Some are consolidated and compressed. Others are over a period of 2 years. I think at the large end of it, the higher end of it.
Okay, and do you know how many hours?
I do not have the number of hours, but it is hundreds, if not over. It's an incredible amount of hours.
Okay, and then there's also continued learning as well.
There is. There's a phenomenal amount of continuing education. We also seek out education on our own accord to further increase our depth of knowledge, because we want to feel like we do everything we can for somebody in their time of need.
And the training is specific to first aid and medical care, is that right?
My continuing training, or
The paramedic training.
there's a huge span that we cover. You
Okay.
you try to compress all of this information into these courses, and essentially when you call 911, we need to be able to respond and be effective and treat whatever it is that could be going on. So it's from cardiac, medical, behavioral, environmental, trauma. There's many facets of our education.
Okay.
Yeah.
And you said you've been doing this 20 years, and how long you've been working at Engine 10?
I couldn't give you an exact timeline. I think I did roughly 5 years or more at Engine 10.
Okay. And what sector does Engine 10 focus on?
Engine 10 is the south end of Tacoma.
Okay. And the call out that day was to 96 in Ainsworth. And my understanding is that 96 is pretty much the last street of the city limits for the city of Tacoma. Is that consistent with your understanding?
That's correct. I think we include the sidewalk on the southern edge of the street, but beyond that, now you're in the county.
Okay. So the sidewalk of 96 is the city limits, and so that's the furthest away that you could go south.
Correct. And we're traveling south from our station, so we're in a sense traveling away from any of our help that's coming after us.
Yeah, you mentioned that with the backup unit that was arriving, right?
Correct. We had the ladder, the tower coming from Station 8, and that's at 48th. So we're 5+ miles away.
So I think in your previous interviews, you said that you weren't sure if you guys ran priority or non-priority to the scene that day. Do you remember?
Right. I don't have a independent recollection of that, but there's a difference in dispatch between TPD and TFD. All of our responses we respond to immediately, whereas some calls are put in a queue with TPD. So routine or priority. Priority gives us lights and sirens and the ability to go 10 miles an hour over the speed limit. We still must maintain traffic laws and not cause any undue harm while we travel to the scene. So, but we do respond immediately.
Okay. Do you think that whether you ran priority or routine, that would have made a difference in how you, like the time of arrival at 96 Mainsworth?
No, the time of night, the time of day, there's no traffic, or no significant traffic to delay. I don't think it would have made a difference at all.
And then in terms of kind of scene security, is my understanding correct that you guys won't come on scene until you're informed that it's a secure scene, safe?
That's correct, and that's something we've worked out over the years with TPD, just to keep our providers safe so that we can effectively render care.
Have you had incidents where you've been on scene and it's been unsafe?
I've had many incidents where this has occurred, and so in our continuing improvement process, we've tried to identify those and limit our involvement in those incidents early on so as to limit our exposure to potentially dangerous situations.
And you talked about the concern from some of the officers, this brief interaction about taking off the restraints given Mr. Ellis's actions. Is that the first time you've encountered some concern about taking off restraints of individuals?
No, and so us not being there during the altercation, we take their opinions not lightly. Right? We take them and we consider them. And if they don't think it's safe to do so, they won't allow us to. But if we feel that it is, in this situation, they do so.
And you said that conversation didn't last long, right?
Seconds.
Okay, so there was no delay in your ability to render care to Mr. Ellis at the time by virtue of that concern that TPD had?
Correct. There was no delay in patient care having that brief interaction.
Have you ever encountered a situation where someone seemed to be docile or non-combative and then all of a sudden became combative?
Yes.
Okay. And then in terms of kind of your arrival, so if I'm understanding correctly, you have an individual that's scribing for you, right?
If resources on scene allow somebody to be able to do that.
Okay. So when you arrive on scene, in the I want to say fire truck, but it's an engine, right?
You can call it an engine.
Okay, that goes back to like 5-year-old Mark. But you hit a button indicating that you've arrived.
Correct.
Okay, and then from there, that's included within your pre-hospital care report.
It is. That timestamp is memorialized.
Can you tell me the time of your arrival again?
Our time of arrival was 23:33:09.
Okay, and then obviously it takes you a bit to get all your gear together and get out to the patient, right?
That's correct.
Okay, so then you arrive at the patient at 23:34:41, right?
Correct.
Okay, and right away you're gaining information as to what's going on or what the situation is that you're coming into, right?
Yes.
And then you're also making an assessment of the patient at that point as well.
Correct.
And so one of the assessments that you made was that you felt that his breathing was shallow, that it was deteriorating, respiratory drive.
That's correct.
Okay. And so and I think Mr. Fricky asked about this as well, but so to a non-paramedic, say a police officer, what you're seeing in terms of respiratory drive, would it seem as if they're still breathing?
I can't answer that very well because I don't know what their training is or what their perception is. I can say that there's a potential, if you're not medically trained, your ability to evaluate somebody's breathing is going to be hindered
And can you kind of demonstrate, I guess, what you were seeing in terms of breathing and what Mr. Ellis was doing in terms of breathing?
His breathing was ineffective, so shallow. How would you like me to demonstrate?
So, well, let me ask. So, but his chest is moving up and down, right?
I don't see any pronounced visual chest rise.
Okay.
He is wearing bulky clothing. He has clothes on, right? So perhaps underneath that there is some chest rise. But you don't have to have chest rise necessarily to have a breath, but you should be able to see some sort of chest rise to have an effective breath.
Okay. But to the untrained eye, what you're seeing may not be as visual. Well, let me strike that. To the untrained eye, they may not see it as low respiratory drive, right?
Correct. Somebody could just look at somebody and just assume that they're breathing appropriately.
In that situation, based on what you're seeing.
Absolutely. Somebody could definitely reach that conclusion.
Okay. So you get on scene, you have this discussion about removal of cuffs, removal of the restraints, and that's done, right?
Yes.
And then you're assessing the patient at this point, right?
Correct. I'm continuing to assess.
And I think you used the acronym ABC, right?
Correct. Airway, breathing, circulation. There's a combination where it's circulation, airway, breathing. It's just a mnemonic. Those are the important things, essentially head to toe.
And so the first thing you're checking is his airway and his breathing capabilities. Is that accurate?
That's correct.
Okay. And so and that's why the first thing, you're seeing a problem and you're providing a solution, which is the bag valve mask. Is that right?
Correct. We see an airway. The airway's patent. We see that he does not have adequate respiratory drive, so we mechanically ventilate him. So we've checked off that box, airway and breathing. I'm simultaneously assessing his circulation, and that's where we have an issue.
Okay. And then, well, let me back up
A
for 1 second.
Sorry, we have more of an issue. We have another issue.
Sure.
Sorry.
So one of the other things you noted was that is it Glasgow Coma Scale?
Correct. GCS, short.
That it was 111, right?
That's correct.
And that's a neurological scale, is that right? That he's non-responsive.
Correct.
Okay. So in terms of kind of how he's responding to stimuli, he's not.
He's not.
Okay. And that's not uncommon for you to see in scenarios where someone might be combative and then all of a sudden become go limp or not have any neurological response.
Right. So in that situation you just described, you'd have somebody with a GCS of 446.
Yeah.
Right. So they're moving their extremities. Their eyes are open. They're slightly altered, maybe, and then they deteriorate to a GCS of 111. So 456 is the highest you can get. That's what all of us sitting here today are sitting at. I'm just making sure I'm not saying anything incorrectly.
So
Since you're standing, I'm not sure what that is.
So the other thing that when you first arrive and you see Mr. Ellis, you said that he's either kind of on his side or on his back in a position, right?
Correct.
But he's not on his belly.
Definitely not on his stomach.
And there's no one on top of him.
There's nobody applying any pressure to his body.
You see him either kind of on his side or on his back with an officer behind him kind of bracing him at that point, right?
Correct.
Okay. And so you cut away the clothing, you take away the spit hood that's on him, and you start giving him the oxygen, right?
That's correct.
And if that were the problem, he's not getting better, right?
Right. So he's not breathing appropriately. We start to breathe for him. He still has a pulse. I would expect that with him still having a pulse and us breathing for him, that he would essentially stabilize and we would be able to transport. He's still going to get intubated. We're still going to monitor all these things, account for blood pressure and his oxygen saturation, and treat anything else that we find, any arrhythmias or there's many pathways you could go down once that stabilization has occurred.
And so when you're first assessing him, ABCs, checking airway, breathing, and circulation, so pulse, you just mentioned pulse. So you're feeling his pulse, and he's got a pulse.
He has a pulse.
Okay. And you said that it's weak and thready, and you end up also attaching the defibrillators and the light pack 15 to him as well, right?
Correct.
So you can look and see what his EKG readings are.
Correct. What's his rhythm? What are we dealing with here?
And I mean that's a machine, and it just shows you within a little, I guess, a little visual window that you're looking at.
Yeah, it's a small screen, and it gives you a 6-second rolling display of the electrical activity that it's picking up.
And I'd like to show you, it has not been admitted yet, but I'd like to show you if we can just publish to the witness, Defense Exhibit 2739. Do you have that up on your screen yet?
I do.
And are you familiar with this?
I have seen this before.
Okay. And can we go, what's the first initial rhythm that's marked in your pre-hospital care report? It's, I think at 37:32, is that right?
Correct.
Okay. And can we scroll forward to 37:32, please?
I need to go back some.
Is that good?
That's perfect.
Okay.
Yep.
And can you compare that strip that you're seeing on the exhibit in front of you as well to your report?
I can.
Okay. And is that a fair and accurate depiction of what is contained within your report as the initial rhythm?
So this view here is a much more detailed view than what I see on my monitor in the field. And I actually have time to sit here and analyze and look at it.
Okay.
But it is the rhythm that we saw initially.
Okay. And that this data, the light pack data, that's data that's kept by the Tacoma Fire Department, right?
To the best of my knowledge, I believe.
Okay. And that's kept in the normal course of business. You guys review it in order to help you improve treatment of patients, right?
Absolutely. At levels above me, this is analyzed for improving our care so that we can continue to be the fire department that we are.
Okay. And, Your Honor, I'm going to move to admit Defense Exhibit 2739.
Is this, I have not looked
This is the
at
light
all
pack
because it
data.
wasn't printout yet. Is it the same as exhibit 25?
It's
Which
the
is what we
full
had?
program.
I don't know what you mean by the full program. It's an interactive program as opposed to just a printout?
Yeah.
That's what I'm,
It's the full code stat.
sorry, Your Honor, I'm gonna just need to, look at it
Sure.
for a moment.
Sure.
Yeah.
Fire, Your Honor.
Go right ahead.
Thank you. Lieutenant Wilson, is this the view of what you see on the life path when you're out in the scene?
The lead 2 is lead 2, and you can see, I think we're showing paddles. Yes, this strip, but this view has grids in it so that you can determine, rate. You can further analyze the rhythm with this view. It's the same rhythm I'm seeing. It correlates to exhibit 24, and that it's the same data and the same cardiac rhythms.
But do you know if there is another, the life path program has additional information on it that's not on this one?
This has additional. Is that what you're saying? The life pack in the field has different or more or less?
The actual entire code stat has additional information like impedance and some other items on there that aren't shown on this one or not?
I don't think I see. What are you referring to with impedance?
Have you seen the life pack that has impedance stuff on it?
We don't have that in the field. You're talking about CPR efficiency or effectiveness.
Maybe I can just show you an exhibit.
Well, is the question whether or not Exhibit 2739 contains information that he would not have had available to him in the field? Is that the
Know
question?
that it doesn't contain all of the information that comes from the code stat. That's the question. I'm trying to determine if this is just what he sees versus Exhibit 25, which is a printout from the code stat that has additional information. That's what I'm asking. I can hand you what's been marked as Exhibit 25.
Of course, 25 hasn't been admitted yet either.
It hasn't. I'm just going to show it to them.
Okay.
If you could take a look at that and see if you recognize that kind of printout.
200 pages of. All right.
Well, if you just look at a couple pages, you can see this
Yeah.
show something more than what you see in the scene.
Can you scroll through this again?
Do you want to just start at the initial rhythm that you see?
Yeah. So I'm not seeing any impedance on what I'm seeing on the screen, but I am in this. Okay.
What does it not show?
I think you can click an option to show it on the code stat.
I don't have a working understanding of this. This is outside of my level scope with Tacoma Fire. This is not my job to review this and look at it, but this is the data that came from the life pack, and the rhythm at the top is what I see in the field, as well as the pulse ox and the CO2.
I'm good for default with respect to that. I just wanted to establish what that was different wise.
Can I say something, Your Honor?
No.
Okay.
Okay. Hearing no objection, I'll admit 2739.
Okay. We can publish that. And so this is the Life Pack 15, the data that's collected from that Life Pack 15 that is connected to Mr. Ellis, right?
That's correct.
Okay. So you all arrive next to the patient at 23:34:41, right?
Correct.
Okay. And the initial rhythm, well, can you walk us through this initial strip that we have shows that the life pack's powered on at this point, is that right?
Correct. The life pack has been powered on, but the leads have not been attached yet.
Okay, so we're at 11:36:16. Is that accurate, when it's powered on?
That's what this is what this depicts, correct?
Okay. And can we scroll roll forward to the initial rhythm at 37:30. Okay, so stop right there. Thank you. So now we're seeing obviously that we're seeing the initial electro rhythm that you're capturing from Mr. Ellis. Is that accurate?
Correct. The leads are attached, and this is the electrical activity of his heart once it is attached.
And when you're at the patient at 23, 34, 41, are you immediately, obviously you're checking ABC, so you're checking pulse is one of the first things you're doing?
Right. I've done that prior to the monitor probably even being turned on.
Okay, so, and you're checking that through the carotid artery, is that right?
They're, carotid, femoral, distal, yeah,
And you're continuing to check it?
correct.
Okay, so at this point, from 11:34:41 up until this initial rhythm, 37:32, you haven't started CPR, right?
We have not.
Okay, so he's had a pulse this whole time.
He's had a pulse.
'Cause if he didn't have a pulse, you guys would be doing CPR at this point. Is that
Correct.
fair?
And that's why I'm checking a pulse as soon as I get to his side. I need to decide very quickly if this is somebody who is in cardiac arrest or not. And if you have a pulse, you are not in cardiac arrest.
Okay. And can you walk us through what you're seeing in these initial rhythms? Well, hold on, time. So when you're writing your pre-hospital care report that's been admitted, I believe is Exhibit 24, you don't have an opportunity to see this actual data from the Life Pack 15, right?
That's correct. In this mode, you can review the entirety of the event, whereas what I'm looking at is these snippets that are contained within my report
Okay.
to write my report.
And that's automatically, it automatically takes snippets from those.
Right. I don't get to go through and say, I want that, I want that. I don't get to go through and say, okay, it looks like we started CPR here. It's like, this is to the best guess what time this transpired at.
Okay. And so, and when you did your interview with the Washington State Patrol initially, they never showed you the Life Pack data, right?
That's correct.
All right. And then you did an interview with the Attorney General's office with Dr. Clark there, and they never showed you the Life Pack data also.
That's correct.
And then you did an interview with the defense, and we showed you the Life Pack data, right?
My interview with the defense was the first time I'd actually seen this data.
Okay. So, with that in mind, let's walk through these initial rhythms that you're seeing. You mentioned that your concerns about the atrial rhythms.
Correct.
So can you explain to us what you're seeing and why it's concerning?
So there's a disassociation between the little bumps between the bigger complexes. They're not.
Lieutenant,
Yeah.
can you step down if that's okay, Judge? Sure. Okay.
Came prepared today. So, question.
Sure. So walk us through some of the concerns you have, given the readings that you're seeing in these rhythms.
We asked them about the little bumps first.
Sorry, the atrial bumps.
Sure. So the atria is the top of the heart, right? It's where the electricity should start from and should flow freely through the heart so that you get a nice, complex, good pulse. This is the atria firing at a rate of around 200. But we're only getting a perfusing beat anytime the ventricles, the bottom of the heart, actually fire. So his pulse here, the distance between these, if these translated across the entire screen, his pulse would be 33. But had each of these atrial complexes fired appropriately and the electricity traveled appropriately through his heart, he'd be closer to 200, if that makes sense.
Okay. And then, so, if my understanding is correct as well, the larger segments are the ventricle rhythms. Is that right?
Correct. That's the QRS complex.
Okay. And so you're talking about the heart. That's essentially the heart goes lump dump, right? The atrial is the lump, and the ventricle is the dump, right?
Correct.
Okay, and so you're saying that the atrial lump is going lump, lump, dump, lump, 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 dump, right?
In this case, it beats 1, 2, 3, 4, 5, 6 times before you get the ventricles to fire.
Okay. Meaning that the heart wants to go really fast, but it can't.
Right. There's something impeding this, whether it be disease or I don't know, because I don't know this individual. I don't know his medical history. I don't know what the impedance is. And it appears as if there's almost a complete disassociation. And this is looking at the data afterwards, because in the moment I get a split second to look at this. So in my report, I note sinus. So I believe that it's originating in the sinus node, the SA node at the top of the heart, and we're getting a complex. But if you come back and you can analyze it and take your time, we don't have in the field. I need to treat right now. I can't really analyze that in the field. But this is important because his atria is firing at an incredibly high rate, and the complexes are irregular. In a normal heartbeat, a normal person sitting here in the court today, you would have a regular rhythm, right? Unless you had some sort of other AFib or some sort of disease where it's like there is a disassociation. So,
Okay. And if we keep scrolling, can we keep scrolling to the next segment? And so this is all, you're seeing all of this.
I think can you back up?
Yeah, of course. Let us
Okay.
know where you want to back up.
Keep a couple more seconds. Okay. This is very scary to me as a paramedic.
I'm sorry, can you put a time on that?
Sure. He's looking at, go ahead. What time are you looking at?
And somewhere after 3807 to here. This is, you've got a pause here with no complexes, no pulse. So his atria is still firing at that increased rate, but you have this potentially junctional, so the middle of the heart's trying to take over because the atria, the top of the heart, isn't communicating very well with the bottom of the heart. It's like you're upstairs, the electricity isn't going to the basement. You know, you're having electrical problems in the basement, they don't know what's going on, so they're going to try to figure it out on their own. So that's what I'm seeing here. I don't know if he's even going to have another pulse after this. We're very concerned with this. So.
Okay. And then can we keep scrolling? Because I think. So then he goes back, right, to having those atrial complexes again.
Yeah, they're still there. We see some organized activity, and this is while we are aggressively ventilating him. So we're attempting to oxygen him. His heart's trying to circulate that blood volume. We're putting the air into his lungs, but the circulatory volume has to be circulated for that oxygen to be picked up and distributed.
And this tells you as well that his heart is not perfusing properly, right?
Absolutely.
Okay. And what do you mean by his heart is not perfusing properly?
It's not beating consistently or adequately. His heart is having a hard time here.
Okay. And you're continuing to feel his pulse at this point, right? And you haven't started CPR, so you know you're at least still feeling a pulse at this point. Whether it's thready and weak, you're still feeling one, right?
Correct.
Okay. And then can you tell us, well, let me ask this. This is not a normal EKG reading, right?
This is an abnormal EKG reading.
Okay. Can we pull up, can you have a seat real quick, because I want to show you one
Love
other
to.
thing. Can we pull up 2738 and publish it to the witness, please? And I'm showing you this just for illustrative purposes. And is it up on your screen?
It is not.
Okay. Let me know what it is.
It is.
Okay. So is 2738, is that consistent with what a normal sinus rhythm would be?
This is a textbook normal sinus rhythm.
Okay. And Your Honor, I'm going to offer 2738 just for illustrative purposes only.
No objection.
Okay.
Hold on. We have other parties here, you know.
No objection.
None.
Okay, 2738 is admitted for illustrative purposes only.
explain to the jury why this is normal sinus rhythm and what it is that makes it normal sinus rhythm?
Absolutely. Can I stand?
Please.
Okay. So the P waves I was talking about in the other one, you can clearly see a P wave here, followed by a QRS complex, and then a subsequent T wave. So depolarization and then repolarization. This is a normal EKG.
Yep.
Yeah.
And so the things that make it normal is that it's consistent, right?
Correct. You can march it out. The distance between each of these complexes remains the same, as does the distance between the P wave and the QRS complex. And each complex has a P wave. There's no additional P waves. There's no additional premature QRS complexes. There's no irregularities here.
I think it's regular rate and resemblance, right?
Rate, rhythm, yeah, resemblance is another word.
Okay. So that you're seeing the same thing happening all over again, right?
Correct.
Okay. And then can we switch back to the life pack data real quick? Correct, 2739. Okay. And so, obviously, we're looking at Mr. Ellis's EKG here, right?
Correct.
And that doesn't look anything like normal sinus rhythm, right?
Objection, argumentative.
Well, he's asking him if it is or it isn't. It's leading, but I'll permit it.
This does not look like normal sinus rhythm.
Okay. And can you take me to the point, can you see within the EKGs of when you guys first start CPR? And we can scroll forward and you let us know when
Absolutely.
to stop.
I don't know if it's depicted on here. What time is in the report? Or what time do we have that
In the
starting?
report, it indicates CPR is started at 23:41:11.
We could go back.
Can we go to 23:41:11? So it says that, so let's explain one thing as well. So it says that the lead is off there for a period of time, is that right?
It does.
Does that indicate that something's fallen off and you need to put it back on?
Whatever lead is capturing is off at this time.
Okay,
There's a view I've seen where it's asystole prior to us starting CPR.
okay, can we go back for a second then?
There you go.
Okay.
Okay, so CPR has not been started here. We're still seeing these P waves. The QRS complexes are now wider and wider. So, yeah, at a very slow rate. If you could play forward slowly, we'll see these QRS complexes go away.
What do those QRS complexes tell you?
This is his heart beating. It's very slow now. And we have a period here. Nothing. Decision is made to start CPR there. So
Okay.
this is now CPR.
Can you pause it?
So in that, I think that was like 9 seconds.
Okay, so he goes from having this arrhythmia to going asystole, right? Which
Correct.
means his heart rate has gone away.
His heart rate it's gone.
Okay, and then you start CPR right there about 11:40:50.
Correct. We have no electrical activity and we have no pulses.
Okay,
So CPR has started then.
so from the time of your arrival at 34:41 up until 11:40:50, Mr. Ellis had a pulse, because obviously you guys weren't doing CPR on him, right?
Right, if he had not had a pulse, CPR would have been started then. So, and in that time period, we're attempting to breathe for him.
And he's not getting better.
Correct.
Okay. So, for about, 41, about over 5 minutes, almost 6 minutes, that he had a pulse while you guys were there. Is that fair?
That's fair to say.
Okay. And this is a 33-year-old man that you're giving oxygen to, and if it was a respiratory issue, you would have expected that he's going to get better.
Correct. Given his age, I would expect him to respond positively to that treatment. The patient failed to respond positively to that, continued to deteriorate. We're forced to act, we're forced to do CPR, and now we're in this position.
And one of the things I wanted to talk to you about, you mentioned torsades.
Correct.
And if we could go to 12:02:3, so you guys are doing CPR throughout this period of time, right?
Correct.
And you're doing it, it's in a 2-minute cycle. You do CPR, you wait to see if he's got a rhythm. If he doesn't, you get right back on CPR again, right?
Correct.
And so, you've mentioned torsades, and I think the rhythm that you're referring to starts occurring at 12:02.
Correct. It's somewhere in this time frame. We have CPR ongoing. So we've pre-charged the monitor, so you can't just instantly shock. You need that electrical, the ability for it to shock at the amplitude, the joules. It needs to charge to that point so that we can deliver that amount of electricity. So we charge is complete. We stop CPR here, and this is what we see.
And why is that significant to you?
If you could play it forward. CPR stopped. This is the rhythm we see. So, torsades is a very rare polymorphic ventricular tachycardia. Usually, tachycardia, ventricular tachycardia, is very consistent in amplitude. You see a lower amplitude, it increases, it lowers again, and then it increases in amplitude, and then lowers again. It takes me roughly 3.5, 4 seconds to decide I need to shock that. I identify it, I shock it at 200 joules, and we go right back into CPR.
What does that tell you about what the heart is doing at that point when you see torsades?
So, through our CPR, we have been attempting to resuscitate the patient, get his heart to beat spontaneously again on its own. We've perfused the coronary arteries to the best of our ability externally, and the heart is now thrown into this rhythm. And this rhythm is not conducive with life either, but this correlates to something very serious going on in his heart.
Something mechanically that's wrong with his heart.
Right, this does not produce a pulse, or I do not feel a pulse with this.
And the electricity of the heart that you're seeing there shows you a irregular heart as well, right?
Correct, it's a very irritable, it's ventricular tachycardia, this is not a good thing.
Okay. And how often have you seen that?
I've seen it a handful of times in my career. It's something as a department we see only several times.
Okay. And in your experience, does epinephrine cause torsades?
No.
Okay. So, other thing, I think you can step down now. I don't think I have any other questions, but I appreciate that. So the other thing I wanted to cover with you is the oxygen sensor, the O2 sensor. It doesn't look like there's ever an O2 reading on this life pack data. Is that accurate?
That's accurate to say.
Okay. And is that because you guys just never connected it?
It's either it wasn't connected or it was unable to get a reading.
Okay. And is it uncommon for you guys not to deal with the O2 sensor and just deal with the issue that's in front of you?
Right. Our primary goal is to treat the patient, and connecting other wires and things get in the way of me trying to manage his airway and establish an IV. We have too many things to do with just 3 of us, and our incoming units are at a greater distance than we'd like. So,
And the other thing I wanted to talk to you about is so you did the bag valve mask, and then you do the OPA and intubation, is that right?
innovation, correct.
Okay. Is OPA and intubation 2 different things?
They are. An OPA is an oral pharyngeal airway. That just opens up, keeps the tongue up away from the trachea, enables us to ventilate the individual more effectively and decrease, I guess, aspiration would be a good thing to avoid.
So, and if there's something obstructing Mr. Ellis's airway, is that something that would inhibit your ability to intubate him?
Yeah, if there was an obstruction in the airway, that would increase the effort it would take to intubate him.
And did you ever encounter anything like that?
There were no obstructions in his airway when I went to intubate him.
Is there a camera that's on the intubation as well?
We have that capability now. I don't believe we had that then.
Okay.
But it's a visual procedure. You align the airway so as you can visually see down into the airway. There's a blade on a handle that's inserted to displace tissue up and away so that I can visualize the vocal cords. I do this in this case. I remember it distinctly. And you pass the endotracheal tube, which is a plastic tube with a balloon on the end. That goes through the airway. The balloon's inflated. It then isolates below the vocal cords that entire airway to avoid aspiration and to effectively ventilate the patient.
Okay. And so, given the presentation, last couple questions I have for you, Lieutenant. So, given the presentation of Mr. Ellis upon your arrival, he had a pulse, right?
Correct.
And he had deteriorating respiratory drive, right?
Correct.
And this may seem like a stupid question, but you wouldn't have expected, given his presentation, obviously, that any of the Tacoma Police Department officers would have been performing any type of CPR on him, right?
No.
Okay. And you wouldn't have expected them to be performing any type of first aid at that point either, right?
No, it's my general understanding that they don't have that training, or at least some of them might have it prior to their job here, but that's not part of their training. That's our job, essentially.
And when you started treating Mr. Ellis, is it fair to say that the Tacoma officers were, they weren't hesitant to help?
They helped more than I would ever expect. They helped immediately, and we needed their help.
And some of them helped with CPR, right?
They did.
That cycle of making sure that you're getting adequate CPR to Mr. Ellis.
Correct. And their willingness to help enabled us to continue to perform the higher level treatments that they're not trained to do, like intubation and IV access and drug pharmacological therapies, and so that we can focus on those things while CPR is being performed and we cycle through.
Okay. I believe I have any other questions. Thank you, Lieutenant.
Thank you.
Redirect.
Few questions. Lieutenant Wilson, do you know what positions Mr. Ellis was in prior to your arrival?
I do not. I was not there to see.
Right, and were you ever given any information that an officer had been on Mr. Ellis's back while he was restrained?
Not to my knowledge.
Over.
Characterize his back.
I'll permit this. You may continue.
I'm sorry, did you receive that information?
I was not told that information.
All right. Now, you talked about Mr. Ellis having a pulse, And just so that we're clear, 'cause I think you talked about this before and it's in your exhibit 24, what kind of pulse did he have?
He had a weak and thready pulse.
And how, and was it also bradycardic?
As it was irregular. So
Okay, and tell us how irregular, what was the variation of how irregular it was?
it would speed up and go slower. As you could see from the prior exhibit, the rate is sporadic. At times it's very slow, and at times it's within normal or higher than that.
And at times when it's very slow, how slow was it?
I think from the initial 30s.
And that's not a normal pulse to have a pulse of 30?
No,
Was that concerning to you?
absolutely.
Are you familiar with the DSM-5,
What does that stand for?
the Manual Diagnostic and Statistical, I think it's the way it's called, it's the manual that sets out diagnoses for doctors. Are you familiar with that?
I am not.
And I take it then that you have not studied the DSM as part of your training as a paramedic?
Correct.
In terms of excited...
Isn't that only for psychiatric evaluations?
I think there are others in there as well, but yes.
Okay, go ahead.
With respect to excited delirium, first of all, as your paramedic, is your job to determine cause of death?
I think as I stated earlier, I'm not a medical examiner. My job is not to determine cause of death, only to identify and treat immediate life threats and attempt to stabilize the patient, transport the patient to definitive care so they can have a positive outcome.
But in terms of cause of death of Mr. Ellis, that would be something left to the medical examiner, is that right?
It's up to the medical examiner to determine cause of death. That's correct.
And you talked about, first of all, you did receive information from Tacoma PD about Mr. Ellis purportedly suffering from excited delirium, is that right?
Correct. I think I stated that in my subjective part of my narrative as well.
All right. And do you recall when you were interviewed by the Attorney General's office that I asked you some questions about what other observations that you made of Mr. Ellis that might suggest excited delirium? Do you recall being asked those questions?
I do.
Do you recall saying that if you had just seen Mr. Ellis on the street, you didn't have
Your Honor, I would
information?
object as to the.
Well, it's really not like, if this was like a deposition, it would be an improper use of the deposition. I'm not sure why I should treat it differently. Well, why don't you just ask him whatever the question was and see what his answer is?
That's what I was attempting to do.
Well, you don't need to show it to him, right?
All right.
Ask him what the question is, and we'll see what his answer is, then you can see if it's different.
Do you recall saying that if you had seen...
No,
Mr.
hold on.
Ellis-
Not a recall saying, ask him the question about whatever it is that was the topic.
Lieutenant Wilson, if you didn't have any information from Tacoma Police about Mr. Ellis's condition, about his purported excited delirium, at the point when you first contacted him, when you first came up and saw him, were there any medical signs that you saw that suggested that Mr. Ellis was suffering from excited delirium?
So that would be an incomplete picture, I think, is more words or less how I stated in my response in that deposition, that treating this patient, you have a very limited view then of what the potential disease processes or what the events were leading to them in that position. It's a stab in the dark, I think I referenced. I think it's a guess. As you further gather information, though, that idea, that prognosis or that diagnosis will change. So as I gather information, if they have a pulse, if they don't, if we can get an EKG, if I can look at different things. People collapse for all kinds of reasons. People go into cardiac arrest for many reasons. I couldn't drive down the road and stop and tell you exactly what happened prior to somebody going into cardiac arrest on anybody. It's
Without some additional information.
right. It's a very, but that I have been in that situation where, somebody who's out for a run or whatever they're out for, somebody driving by sees somebody collapsed on the side of the road, and we're called to respond and treat. And oftentimes we're able to ascertain and have an idea of what has transpired prior as we gather information and as our treatment modalities change and as we assess and we treat, reassess, retreat, and attempt to resuscitate.
And, with respect to, Mr. Ellis's breathing when you first arrived, we looked at the life pack information. At the point you put him, on the leads, had you already started the mechanical breathing for Mr. Ellis?
That's correct. That was we utilized the BVM very quickly.
And when you say very quickly, how long after you came to his side and evaluated him did you put the BVM on?
I couldn't give you an exact time, but in the time it takes to open our airway bag, grab the BVM out, remove the plastic, pull it apart, connect it to oxygen, put the mask on, and put it over his face. That's about the timeline.
All right, and why did you do that immediately in the manner that you just said?
Because we still have a pulse and he's not breathing effectively. So it's a very important thing for you to stay alive. You need to breathe. And if we can assist in that, ideally, our hope is that the cardiac tissue will stabilize, he'll stabilize, and we can transport, and he can receive further care in the emergency department.
Okay, just a moment. That's all I have, thank you.
I have no follow-up, Your Honor.
Couple questions.
Go ahead, Mr. Esser.
Just so I'm clear, Lieutenant, the expectation if it's a respiratory issue is that once you introduce the oxygen, you would expect some improvement in the condition of the patient, right?
That's correct.
And that's why when you feel the pulse initially, you begin with the mechanical providing of oxygen to Mr. Ellis, right?
Correct.
And when you did that for up to the 4 minutes that we know before you started CPR, that created no improvement in his condition whatsoever.
That's correct. Even with adequate oxygenation and respiration mechanically, he continued to deteriorate.
Right. Meaning his heart wasn't reacting at all to the application of oxygen to his system.
Correct. He failed to positively improve.
Right. His heart continued to decrease despite the fact that you were introducing oxygen to deal with his lack of respiratory action.
Correct. The irritability that I noted on that data continued to persist.
And that, what you just described, the application of oxygen and the reaction by the heart is also consistent with sudden death attributed to excited delirium, right?
Sudden death in excited delirium, yeah, a respiratory collapse because whatever is going on internally at a physiological level is not appropriate for that person to maintain life.
And that's what you told Dr. Clark repeatedly during March of 2021 with the AGs present, right?
In more words or less.
Mr. Conrad.
I don't have any follow-up.
So good, Your Honor.
Okay. All right. Lieutenant Wilson, you are excused. Thank you.
Thank you for your time.
And it's now 2:45, so we'll take our afternoon recess for 15 minutes. Ladies and gentlemen, please do not discuss the case. Looks like there's like a bag here to the left of the pants.
That's the evidence bag.
That's evidence bag the pants were in,
Correct.
or were put in afterwards, or
Well, they were taken out of the evidence bag.
photographed.
Photographs were taken and then put back in.
Gotcha. I don't know.
Judge, quite frankly, I'm fine.
And this is front and back, right? I'm sorry?
It is.
I'm fine either way, but we already have the evidence in it, they already showed the evidence.
Is there a need for this?
Your Honor, the state's requesting to be able to admit those because, as the court saw, the pants are cut off.
Yeah.
And difficult, I don't know if you saw how difficult it was to maneuver them a little bit in the publishing to the jury. The photograph has them, laying properly with the front and the back put together. In addition to that, it does allow for the jurors to just pass the photograph around and look at versus everybody putting gloves on if they want to look at the pants. But
Do we know which side is front and which side's back?
the tag is on the back, Your Honor, assuming that's the portion that is not cut. If the court hands them back, it can identify which one will be the back of the pants.
Well, this one's 248.
That's the front,
This is 249.
that's the back.
Well, it appears that the pants are dirtier on the front than on the back, and I assume that's something the state is trying to highlight here.
That's true, Your Honor.
I don't see otherwise why it couldn't come in. When was the photograph taken?
It was taken that same month. I'd have to look at my notes.
In
for
March,
exact-
March of 2020?
Yeah, it was taken, March 26th, Your Honor.
Okay. That may be more like what their condition was then. I don't know what they've gone through. Almost nothing, I would think, since they're in an evidence bag, but I don't see a real problem with it.
Thank you.
Very good.
Okay, so who is our next witness?
Jackie Franklin, Your Honor.
Jackie Franklin?
Yes.
Okay, are we ready for the jury?
Yes, Your Honor.
Okay, let's have the jury. Welcome back, everybody. Please be seated. Okay, your next witness.
Thank you, Your Honor. State calls Jacqueline Franklin.
Yes, ma'am. Yes, please come forward to right about here. And then raise your right hand to be sworn. Solemnly swear or affirm that your testimony in this cause will be the truth, the whole truth, and nothing but the truth? Thank you very much, ma'am. Have a seat right there. Please state your name and please spell your name.
My name is Jacqueline Franklin. It's JACQUELINEFRANKLIN.
Thank you. Mr. Loop.
Thank you, Your Honor. Good afternoon, Ms. Franklin. Can you tell us what your occupation is?
I'm a senior criminal investigator,
And who do you work for?
Washington State Attorney General's office,
And how long have you been so employed?
since 2013, so about 10 years.
What are your duties as senior criminal investigator?
Primary duties are the investigation of Department of Revenue crimes and Department of Labor and Industry crimes, and special assignment as needed.
Okay. And is that in your capacity working on this case, special assignment?
Yes.
All right. Ms. Franklin, were you asked to take measurements of an item of evidence involved in this case?
Yes, sir.
And what were you asked to do?
I was asked to measure the hobble.
And well, do you recall when you did that?
It was June 26th, 2023, this year.
Okay. And where did that take place?
Washington State Patrol, Marysville.
And is that their headquarters in Marysville, is that correct?
Yes.
Were the attorneys for the state and the defense present during that?
Yes.
And can you describe for us what you did?
I came to WSP. I was brought into a conference room, and I was given the evidence by the evidence custodian for WSP, and I took it out and measured it.
Okay. Ms. Franklin, I'm going to if I may approach you on it. Sure. I'm going to hand you what's an envelope marked as State's Exhibit number 100, and see if you recognize that envelope.
Yes, sir, I do.
And how do you recognize it?
By the evidence number and the color. It appears to be the same envelope.
Is there an evidence number associated with that envelope?
Yes, sir.
And what is that number?
CY6270.
And describe for us what you did in terms of measuring the item.
It was on a white cloth sheet. It was just taken out of the envelope. It was laid down and just photographed as is. And then using a flexible measuring tape, I just measured around the hobble.
All right, thank you. Ms. Franklin, I have a pair of scissors and some gloves there on the witness stand. If you could take a look, open up that envelope, Exhibit 100, and tell us if you recognize what's contained in that envelope, please.
Yes, I do. I recognize it.
How do you recognize it?
By the look of it, it's the black hobble I photographed and measured.
Okay. And is there an evidence tag on that item?
Yes, sir.
Okay. Would you mind, without showing the jury the item, if you're able to see the tag number?
It's the same tag number, CY7260.
Okay. And does that item look in substantially the same condition as you saw back on June 26, 2023?
Yes, sir.
Okay. Now, you indicated you took measurements of the hobble. And again, what did you use to measure it?
It was a flexible tape measure.
Okay. And from what point to what point did you measure the hobble?
One measurement was from the carabiner on the end to the inside of the metal claw,
And what was the length of the measurement?
about 29 inches.
All right. Your Honor, the state moves for admission of Exhibit 100.
Your Honor, no objection.
100 is submitted.
All right. state moves to publish on it.
Proceed.
Thank you, Ms. Franklin. Your Honor, I have no further questions.
Your Honor,
Mr. Pritchard?
Ma'am, good afternoon. With respect to the hobbles, and let me just grab a glove here if I might. When you did the measurement, I'm assuming that you moved the buckle all the way to the end?
No, sir.
You didn't.
It was photographed as is.
So you measured it as it's, the 29 inches was measured like this,
From the end of the carbinger,
right here,
from there all the way around.
all the way around.
Go the other way, opposite
Okay, so-
direction.
Yeah, so you went
All the way around
Yeah,
to
you
there.
didn't- You didn't bring the buckle over.
No, sir, I didn't.
And also, do you know where this was at before you measured it? I mean, who collected the item?
I don't know who collected it.
Okay, so you don't know the chain of custody of this particular item.
I'm not aware of that, sir.
All right, thank you, Judge, that's all I have.
Mr. Urbans? Okay.
Ms. Franklin, good afternoon.
Jenny?
Just a few questions for you. So you're employed by the Attorney General's office, is that right?
Yes, sir.
And in this case, you mentioned this is a special project, fair to say?
Something other than my primary duties, yes, sir.
Okay. And how did you come to be involved in this case?
I volunteered and said I wanted to help assist, and I was asked to assist, and this was one of the things they asked me to do.
Okay. And who did you report to?
This was through Dave Heitzman.
Okay, so Investigator Heitzman from the AG's office?
Yes.
Okay, gotcha. And you were tasked with a few different investigatory obligations or requests, is that fair to say?
Yes.
Okay. And was one of those to track down an individual named Robert Boggin?
Your Honor, this is going beyond the scope of what Ms. Franklin was asked to testify to.
Sounds like it.
Just wondering what she did on the case, Your Honor.
She probably punched a time card and submitted that a couple of times too, but I'm just thinking, what does it have to do with the direct examination? Okay, well, then I'll sustain the objection.
Fair enough.
Appreciate your candor.
So, to be fair, there were other aspects of this case that you were involved in, is that right?
Correct. Yes.
And did you have other contact with other individuals associated with this case?
Your Honor, again, it goes to the same objection. It's beyond the scope of what she was asked to testify.
Unless you got to show me where this has gone, I'll sustain the objection.
Nothing further, Your Honor. Thank you.
Okay. Mr. Conrad?
Good afternoon, Ms. Franklin.
Good afternoon.
So, this is a special assignment for you, is that correct?
Yes.
Okay, for the Attorney General's office?
Yes.
Okay. Do you know about the independent investigation team
Your
that was
Honor,
assigned?
this is going beyond the scope of direct and has no relevance.
They asked about her background and training for her background and involvement in this case. I can delve into that.
Well, finish your question, then I'll decide.
Sure. So are you aware of the independent investigation team that's also investigating this matter?
I'll let that go. You may answer.
And am I aware of the independent investigative team?
Yeah, through the Washington State Patrol.
No, I'm not aware of that.
Didn't you go, isn't the evidence tag that's associated with this with the Washington State Patrol?
You asked if I was aware of the independent investigative team. I'm not aware of that.
Okay, but you're aware of the Washington State Patrol's involvement in this matter, right?
That's where I went to photograph that, yes.
Okay, that's where you went to photograph and take this item from, is that right?
I didn't take the item from there. I took the pictures and measured it there.
Okay. So you went to Washington State Patrol to one of their departments or one of their facilities and took pictures of this hovel?
Marysville, WSP, yes.
Okay. And you're aware that Washington State Patrol is is investigating this matter, right? Or investigating this matter, I should say, right?
I'm not aware of what Washington State Patrol is doing in this.
You're not?
I'm not aware of what they're actually doing. My task was just to go and take photos.
Okay. You're not a police officer or a peace officer, is that right?
No, sir, I'm not.
Okay. And is it fair to say that your involvement in this is outside of your typical job responsibilities?
Yes, sir.
Okay. And so you don't know who Washington State Patrol Detective Rue is?
No, sir, I don't.
Okay. What about Washington State Patrol Detective Markin?
I don't know who that is.
You don't know who that is either. So the Attorney General's office never made you aware of the independent investigation team that was investigating this matter?
I was informed and instructed to go measure, and that's what I did.
Okay. I appreciate it. Thank you.
Nothing for the Honor.
Just one question.
Mr. Emmons?
You said you volunteered for this job. What did you volunteer to do?
What they asked me to do.
But they did ask you to do other things.
They asked me to do things, yes.
Okay.
Mr. Conrad?
I don't have anything further on
Nothing for the Honor.
Okay. So, Ms. Franklin, you are excused.
Thank you, sir.
You just asked that she be subject to recall.
Any problem with being available for recall in this case?
No, sir, I don't.
Thank you very much.
Your Honor, the state's next witness will be Pierce County Sheriff's Department Investigator Steve Mel.
Okay, thank you. Yes, sir, please come forward right about here and raise your right hand to be sworn. Solemnly swear or affirm that your testimony in this cause will be the truth, the whole truth, and nothing but the truth? Thank you very much. Have a seat right there. Please state your name and please spell your name.
First name is Stephen, S-T-E-V-E-N. Last name is Mel, M-E-L-L.
Thank you. Ms. Sticolovo, when you're ready.
Good afternoon.
Afternoon.
Could you tell the jury where you're currently employed?
Yes, I'm employed with the Pierce County Sheriff's Department.
And what is your position with Pierce County Sheriff's Department?
My title is Forensic Investigator.
How long have you been a forensic investigator with Pierce County Sheriff's Department?
With Pierce County since 2005.
you have prior law enforcement experience?
Yes, I have about a year and a half with the Scottsdale Police Department, and then I also had about 5 years with the Pierce County Medical Examiner's Office.
What was your position with the Pierce County Medical Examiner's Office?
My title there was Medical Investigator.
And what was your position with Scottsdale Police Department?
My title there was Crime Scene Specialist.
As you've been with Pierce County Sheriff's Department, have you held any other position besides forensic investigator?
No.
Can you tell the jury what your duties include as a forensic investigator?
Yeah, so we wear actually quite a few hats as a forensic investigator with the Sheriff's Department. Basically, what we do is we help our deputies and our detectives respond to different crimes throughout the county. We help them document and collect evidence within those scenes. A big part of our job is just the photo documentation of those scenes. And it really depends on what kind of scene that we're responding to that demands what we actually need to do at that scene.
Did you, back in March of 2020, did you also work with forensic investigator Steve Wilkins?
Yes, I did.
Did you have the opportunity on March 4th of 2020 in the early morning hours to respond to in custody death scene at 96 in Ainsworth in Tacoma?
Yes, I did.
Who was there to assist you?
I was there to assist Steve Wilkins.
So how did the two of you work as a team, though, for the scene?
Kind of. We kind of divvied up some responsibilities. Initially he was going to handle photographing and videoing the scene and whatever evidence was associated with that. And then my responsibility was going to use our three-dimensional laser scanner to document the scene.
That was the initial assignments. Did you actually go through and do the 3D laser scanner?
Yes, I did.
Is that also called, referred to as a Faro scans?
Yes, it is.
And we've had some prior testimony about those scans. When you did the Faro scans, did you have any difficulty at all or any problems in executing that?
No.
So they turned out accurately based on the information that you had?
Yes, I did.
And then also with that, I understand that you set up the scan in 4 different positions at the scene.
That's correct.
Why did you choose the positions that you chose?
The positions I choose is kind of just based on what kind of angles and surfaces I'm looking at. When the laser is actually functioning, it functions on a line of sight. So if there is a surface that it's striking, but I want to get something captured behind that surface, I need to relocate the scanner so that it can see behind that surface. And so in deciding where to place the scanner, we kind of generally pace off about 15 steps and kind of try to find a new spot to put the scanner that's going to capture all those areas within the line of sight.
Are there times when you use more than 4 positions for scanning a crime scene?
Yes.
How do you decide the number to use?
It depends on the location, where we are, how many walls, or whether it's interior or exterior for starters, whether we have a lot of cars in the way, different buildings in the way, or inside, how many walls we're trying to transition through, and just how much area that we're trying to capture.
When you make determinations when you arrive to a scene to process it, do you rely on the information that you receive from detectives who are also processing the scene?
Initially, yes.
When you arrived at 96 in Ainsworth, approximately what time were you dispatched out there?
I believe I got the call at about 12:30 in the morning.
Do you recall approximately what time you arrived?
And I believe I arrived shortly after 1 o'clock in the morning.
When you arrived, who did you contact first?
The first person I made contact with was Lieutenant Messinio.
What was the purpose of that contact?
He was the first person that I ran into and made contact with. I don't know that there was a real decision that I chose him to run into.
Did he direct you at all on what to photograph or areas to focus on?
No.
And you said earlier that you started out initially with but doing the Faro scans, and then Mr. Wilkins was going to do the photograph. Did that change at some point?
Yes, it did.
And after, what caused it to change?
I learned that Steve Wilkins was dispatched to a different location, and then that left me kind of in charge to do any other follow-up stuff that needed to be taken care of at the scene. Excuse me. So at that point, I started doing some additional photographing of the scene.
And at that point, were you the only forensic investigator on scene?
Yes, I was.
I want to go through some of those photographs with you. Permission to approach freely, really?
Yes.
And what's been marked and admitted as states exhibit 166, 239, 240, 242, 243, 244, 167, 241, 245, and actually, we'll stop at 245 for now. You take a moment to take a look at those. And I know the first one's already been admitted, but if you can let me know if the other ones are inaccurate depictions of what you observed that night and photograph.
Yes, they appear to be.
Thank you. And although 166 has been admitted, is that also a photograph that you took?
I believe so, yes.
Your Honor, the state offers into evidence 240, 239, 240, 242, 243, 244, 167, 241, and 245.
No objection.
Yeah, when you don't do them in the sequence, then I lose track. Is this, so do this as, for the lowest number and put them in order if you would. 167? Right?
I don't have them in sequence.
Yeah.
We can do that.
Oh, okay. It's hard for me to write this all down.
166 was admitted. the
Right,
lowest
so
one.
we're not working about that one. We're about 167, right?
167 is the lowest number.
All right, then 239,
Correct.
240,
Correct.
241,
Did you ask for 241? Oh, 241, correct.
242,
Correct.
243,
Yes.
244.
Yes.
Yeah, I'm not sure, 245.
Correct.
All right. And there's no objection over here from the defense? All right, so 167, 239 through 245 inclusively are admitted. Thank you.
Now hand you what's been marked as 176, 181, 182, 183, 184, and 185. Take a look at those and let me know if they're fair and accurate depictions of what you photographed at the scene that night.
Yes, I believe they are.
Your Honor, the state offers into evidence 176, 181, 182, 183, 184, and 185.
No objection.
Okay, 176 and 281 through 181 through 185 inclusively are admitted.
I'll hand you 177, 178, 179, 180, 246, 189, and 190. Yes, please. Are those true and accurate depictions of what you observed at the scene that night?
Yes, they are.
Your Honor, state offers into evidence 177, 178, 179, 180, 246, 189, and 190.
No objection.
Okay, exhibits 177 through 180 inclusively are admitted, as is 189, 190, and 246.
Your Honor, can I have permission to publish a few of those that are admitted?
Yes, if you'll promise not to run a bunch of numbers by me right away.
I won't. I will do one at a time. So we're gonna. So if we can start with 242, please. And Investigator Mel, it might be easiest for you to step down so you can actually see and point to things if you need to. There's a pointer there.
Pointer where?
There was a pointer up here. Right there.
Oh.
And previously, we've seen several photos of the patrol vehicle that was present at the scene. Do you tell the jurors what 242 depicts?
Yeah, so this is just a photograph looking through the open door, the driver's door of the patrol car.
And is that the patrol vehicle that was in question that night for Defendant Collins and Burbank occupying?
Yes.
And I want to ask you, in that photograph, is there a mic, a handheld mic that's used for call-outs?
Yes, there is. Be located about in the center of the photograph.
And in the center of the photograph where the mic is at, is it in its holder?
I believe it is in a little clip holder that's stationed on that center dashboard.
And I don't need 240 published, but if you can just take a look at 240, what's the patrol vehicle number on there?
The patrol number is 2773.
Thank you. And if we can have 244, please. And can you tell the jury what 244 is, please?
Yeah, so it's another photograph of the same patrol car, except for now we are looking through the passenger's door, which is open. So this would just would be the passenger seat of the vehicle.
Can we have 167, please? Now, Investigator Mel, when you took these photographs, were the doors already open on the vehicle?
No, when I initially started photographing the vehicle, the doors were closed.
And to your knowledge, had anybody gone into the vehicle in the time that you were on the scene?
Not to my knowledge, no.
And based on your understanding of crime scene preservation, would it be that people aren't supposed to touch or change anything on scene?
Correct, ideally, yes.
And so, what is 167 depicting, and why did you take this photograph?
So this would just be a series of photographs. When I was asked to photograph the patrol car, kind of just a series of photographs that I go through, because I would go all the way around the vehicle, photographing the exterior. In this case, the doors were closed, so I opened the door, photographed the interior. As I'm stepping away from the vehicle, then I also start to include what we call a perspective shot. So if an officer was stepping out of the vehicle, it's like, well, what would they see internally? And that's just one of that type of series of photographs that I captured.
So part of that purpose is to capture in a photograph what is in front of the vehicle from the driver's perspective?
Correct.
And if we can have 241, please. And can you tell us what that is?
That's a very similar shot. It would just be more like if you, from a position of stepping right out of the vehicle and looking over the door. The previous photograph would be if you were standing 1 or 2 steps back from the door.
And could we have 245, please? can you please explain to the jury what that depicts?
Yes, and this is within the same series of photographs, except for now this photograph is taken from the passenger side of the vehicle.
And the purpose of that is for also capturing the scene from the perspective from the passenger side?
Yes.
And the photographs that you took at the scene, did it also include photos of Mr. Ellis's body?
Yes.
And on 245 is where he's at in the roadway, is that the way you found him?
Yes.
And if we could have 176 up, please. And can you please tell the jurors what 176 depicts?
This is a photograph of Mr. Ellis's right hand.
And the blood that appears on the hand, was there any cleaning or anything that would have removed any of that prior to you taking the photograph?
No.
And if we could have 181, please. And could you please tell the jurors what you took, what this picture depicts, and why you took this photo?
Yes, this is another photograph of Mr. Ellis's, well, this is not another photograph, a photograph of his now left hand. And the photograph was taken to capture any of the abrasion injuries on his hand and any other markings that we might see.
And what was the other marking that you just pointed out besides what the ones that are, have blood on them?
It's this kind of linear type of abrasion or bruising around the wrist, which would be consistent with handcuffs.
And if we can have 183, please. And could you tell the jury what that depicts?
That's another photograph of his left hand, just another photograph capturing the abrasion going around his wrist.
And did you use a measuring device or scale when you photographed that?
I did, yes.
And could we see 184, please? And is that what you've referenced as a scale?
Yes.
And are you able to make a measurement for that, or is that you use later if you need to?
It's primarily used for later reference in the photographs, but this particular one ranges anywhere from 2 millimeters to almost 4 or 5.
And when you were on scene and documenting Mr. Ellis's body, did you have any difficulty seeing those depressions on his wrist?
No.
You also photographed his legs and lower extremities?
Yes.
And we can have 178, please. And can you tell the jurors what 178 is?
Yes, this is a photograph of Mr. Ellis's right leg, the lower extremity, and centered in the photograph is another kind of an abrasion marking that we could see around his ankle.
Did you do a close-up on that photograph also
Yes, I did.
with a measurement?
Yes.
And if we can have 180, please. And can you tell the jury what that depicts?
Yes, it's the same leg, just kind of more of a close-up photograph to include a scale, capturing the width of the abrasion there.
And is that the interior of his leg?
Yes.
And if we could have 246, please. Can you tell the jurors what that depicts, please?
Yes, it's another overall photograph of Mr. Ellis's right leg, capturing some of the abrasions that are seen.
And the depression mark at the lower portion that you testified about in the prior photographs, does that go all the way around? his leg?
Yes, it did appear to go all the way around.
And were you advised at all about a hobble being used on Mr. Ellis?
I had heard that a hobble had been used, yes.
Were you also advised, or actually, did you observe a spit hood at all in the vicinity of Mr. Ellis?
Yes, I did.
We can have 189, please. And if you could tell the jurors what 189 depicts.
So this is an image of Mr. Ellis's head, primarily the left side of his head, but underneath his head you can now actually see what is referred to as a spit screen that is placed underneath his head.
And when you were on scene, were you able to determine if the reddish colored, or did the reddish color fluid on the spit hood appear to be blood to you?
I'll permit this.
Yes, it appeared to be blood.
And if we could have 190, please. So on 190, can you tell the jurors what it depicts?
Yes, it's just an overall photograph of Mr. Ellis as we were able to roll him onto one side and take a look at his back.
And is the spit hood still attached to that proportion of his head?
Yes, it is.
Did you take any photographs at the scene once Mr. Ellis's body had been removed?
I believe I may have taken one photograph.
If we could have 247, please. Is that the photograph that you're referencing?
I believe so, yes.
Okay, and can you tell us what perspective this would be from?
Like directional, like north, south, east, or west, or?
Let me rephrase it. It was a poorly phrased question. Where would the patrol vehicle be in relation to the manhole in this picture?
It would be off to the left, or excuse me, to the right of the photograph.
And the intersection forward to the left?
I'm sorry?
The intersection, the main intersection would be further to the left if you're looking at the photograph?
Yes.
Go ahead and have a seat for a moment, please. There's a few more with you that we can bring it down. I'm sorry, Your Honor. 247. Only thing we ran through before over the break, so there was no objection to it, but I apologize, Your Honor. That was my mistake. I do want to admit 247.
Any objection? All right, 247 is admitted.
Did you also have an opportunity to take photographs of some of the items that were taken into evidence?
Yes.
Do you recall the date that you did that?
The exact date I don't recall. I believe it was a couple weeks later.
Did you write a report regarding, did you write 2 reports regarding this, your involvement in this case?
Yes.
And would it assist you in testifying today, refresh your recollection regarding the date of those photographs to review your report?
Yes.
And I'm handing you what's been marked as 724. It's the .25. If you can take a look at that and let us know if that's your report.
Yes, this is my report.
What day did you take photographs of some of the items that were taken into evidence?
This would have been on March 26th, 2020.
We have you 294 and 295. Do you recognize those?
Yes, I do.
Are those true and accurate depictions of the spit hood that we just saw at the scene after they was taken into evidence?
Yes.
Your Honor, State offers into evidence 294 and 295.
I'm sorry, 494 and 495 are admitted.
294 and 295.
Oh, I'm sorry.
If I misspoke, I apologize.
It's probably me. 294 and 295 are admitted.
When you were at the scene, did you also take into evidence or have evidence taken in of the taser probes that were used in this case?
I know that some were collected. I'm not specifically knowledgeable of that. But
Did you take photographs of the ones that were collected in this case after they were placed into evidence?
yes.
And you know what's been marked as 232, 236C. Do you recognize those as photographs of the taser probes that were used in this case?
Yes.
Your Honor, State offers in evidence 232 and 236C.
232 and 236C are admitted.
Did you also take photographs of some of the clothing that was taken into evidence on this case?
Yes.
All right. I'm handing you 248 and 249. Are those true and accurate depictions of the pants, Mr. Ellis's pants that were taken into evidence?
Yes.
Your Honor, state offers in evidence 248 and 249.
No objection.
No objection, Your Honor.
248 and 249 are admitted.
Permission to publish, Your Honor.
Proceed.
If we could have 249 up, please. Investigator Mel, are these the pants that were taken into evidence, photograph of the pants taken into evidence?
Yes, they are.
And are these the back of the pants?
I believe they are to be the back of it.
Here, let me give you 248 and 249 to look at.
Yes, Exhibit 249 appears to be the backside of the pants.
And if we could have 248, please. And are these the front side of the pants?
They appear to be the front, yes.
And are those, actually, strike that. If we can, have 189, please. And that is the spit hood that you also, that was on the scene?
Correct.
All of those?
I think we did a 189 already.
I did, Your Honor, but I'm looking for the two that were taken. There we go. We can have 294 up, please. Is this the same spit hood that was documented at the scene?
Yes.
And 295?
Yes.
It's also the same spit hood.
Yes.
Did you notice anything about it, about the spit hood when you viewed it on March 26th?
Nothing unusual, no.
And the substance that appeared to be blood before, is that dried?
Yes.
Sustained.
What was the status of the fluid that was on the spit hood on March 26th?
At that point, any fluids that were on the spit hood appeared to be dry.
Thank you. We can publish 236C, please. And can you tell the jurors what this is?
Yes, those are the taser probes and the associated wires and part of a clip that were collected.
And we also have 232, please. As a closer up of those.
Yes, that's just a close-up photograph.
And I'm going to hand you what's been marked as State's Exhibit number 98. And based on the labeling on 98, are you able to determine if that is the same as the photographs or what you have depicted in 236 and 232?
It appears to be, yes.
And if you can open it, and don't pull them out, but open it and take a look and see if they appear to be in substantially the same condition as when you photographed them, please.
All right, these gloves are too small, so I'm not going to be able to wear a glove.
You're, I'm sorry, what?
Is there a Kleenex box in the front there? Right here.
I'll use the gloves after you. Are you able to tell if it's substantially in the same condition as when you photographed on March 26th?
Yes, it appears to be.
Your Honor, the state offers into evidence states exhibit number 98.
I'm sorry, that's the same one. Is this the page of what for?
232 and 246.
Okay, no.
Objection.
98 is admitted.
Permission to publish, Your Honor.
Proceed.
I know they fit me. Your Honor, did the court inquire if the jurors in the back were able to view sufficient air?
I'm getting thumbs up, so it looks like we're
Great.
okay.
Did you take the patrol vehicle into evidence at all to have it processed?
I did not know.
And why not?
That's not my call, I guess. I don't.
Okay. Do you know whose call it would be?
I would be one of the command staff.
As in, like, one of the detectives in charge, or?
One of the detectives, detective sergeants in charge, or a higher ranking commander.
Did you process anything on the patrol vehicle?
Nothing other than photographs, no.
Were you directed to process anything at all?
No.
Were there any other items that you took into evidence from the scene?
Yes, there was.
And what were those items?
The only other item I collected was a pair of gloves.
You have photographed, and the jurors have seen some photographs that you took previously of a water jug that was at the scene. Why did you not take that into evidence?
Primarily there was, I mean, we noticed that the water jug was there, but there was also several garbage cans nearby and another container full of a bunch of other bottles and things. It was just, we didn't really know what that water bottle meant, or if it had been there for a long time, or if it was part of this, so.
And what about a box of donuts that was by the patrol vehicle?
There was also a box of donuts on the passenger, or below the passenger's side door of the vehicle.
Why were those taken into evidence?
I think at the moment we just felt like having them photo documented was sufficient.
Were those ever picked up and flipped over to see if they were open?
They were not picked up by me.
Did you ever photograph the top side when you photograph the bottom side? We have photos of it on the back of the box, but we don't have the front side of the box photographed. Is there a reason why that wasn't photographed?
The only thing I can think of is because it wasn't actually collected, so maybe it didn't get photographed all the way around. I photographed it in place and documented that it was there.
And what about a set of lime green, older, Forden earbuds that were by by the water bottle? Is there a reason why those weren't taken into evidence?
Once again, we had no idea whether they meant anything. It was an uncommon area to, find debris on the side of the roadway. I think that we made sure that they were photographed and that we knew that they were there. But,
When you were on the scene, did you observe any receipts or anything of that nature from any stores?
not that I recall.
Did you see a plastic bag at all that was on the street? I know there's trash cans there, but did you see a plastic bag at all?
I don't recall a plastic bag.
Nothing further from the statement.
Yes, sir, Judge,
Well, it's 4 o'clock. How long do you think you'll be?
you know, you'll maybe on 401. Not lately.
You'll be done by 4:01?
Probably fine.
All right, we'll break for the day. Okay, ladies and gentlemen, please do not discuss the case among yourselves with anyone else. Do not permit anyone to discuss the case with you or in your presence, and of course, avoid any reportage in the social media, television, newspaper, radio on the subject of this trial. See you tomorrow, same time.